Vaccines work by training your immune system before a real infection arrives. Your body already has a powerful defense system. It watches for anything that does not belong. When a virus or bacterium enters the body, it carries tiny recognizable features on its surface. These features are called antigens. Think of them as identification tags carried by the germ. Immune cells constantly patrol the body, looking for suspicious antigens that may signal danger. The first time your immune system meets a new germ, it needs time to study it. During that delay, the germ can multiply, spread, and make you feel sick. A vaccine gives your immune system a safe preview of the germ without causing the full disease. It may contain a weakened germ, an inactive germ, a harmless piece of it, or instructions to make one piece. The key idea is simple. The vaccine shows the warning sign, not the full dangerous attack. Special immune cells pick up the vaccine signal and present it to the rest of the immune system. Helper T cells act like coordinators. They tell other immune cells that this pattern matters. B cells respond by producing antibodies, which are small proteins designed to attach to that antigen. Antibodies work like custom keys. Their shape matches a specific part of the germ. When antibodies attach to a real germ later, they can block it from entering your cells. They can also mark the germ, making it easier for other immune cells to find and destroy it. Most importantly, vaccination creates memory cells. These cells remember what the dangerous pattern looks like. Memory cells can stay in the body for months, years, or even longer, depending on the vaccine and the germ. Later, if the real germ appears, the immune system no longer starts from zero. Memory cells react quickly, producing antibodies and activating defenses much faster than during a first infection. That faster response can stop the infection early or make the illness much milder. A vaccine is not a magic force field. Some germs may still enter the body, but the body is prepared. It recognizes the enemy sooner and fights back with better timing. Different vaccines use different teaching methods, but the goal is always the same: safe immune training. Inactivated vaccines use germs that have been killed, so they cannot reproduce inside the body. Live attenuated vaccines use weakened germs that imitate infection without usually causing serious disease. Subunit vaccines use only a small piece of the germ, like a protein from its surface. mRNA vaccines give cells temporary instructions to make one harmless piece, so the immune system can learn it. The mRNA does not change your DNA. It breaks down after delivering the temporary instruction. After vaccination, mild side effects can happen because the immune system is practicing. A sore arm, tiredness, or a mild fever can be signs that immune cells are active. Some vaccines need booster doses. A booster reminds the immune system and refreshes its memory. Some germs change over time. When their antigens shift, updated vaccines may be needed. Vaccines also help communities. When many people are protected, germs have fewer chances to spread. This helps protect people who are more vulnerable, including babies, older adults, and people with weaker immune systems. The choice is not between vaccine risk and zero risk. It is between vaccine risk and infection risk. Vaccines are tested before approval and continue to be monitored after they are used in the real world. A vaccine is like a fire drill. It prepares the system before the emergency happens. So vaccines do not replace your immune system. They teach it what to recognize and how to respond. That is how a small training signal can help the body fight a much bigger threat.